Yellow.
Hello, my name is Jasmine. I'm going to be your nurse today. How you doing?
Good, and yourself?
Good. I'm going to be doing your focused neuro assessment. Is that okay?
Sounds good.
Can you just tell me your first and last name?
I'm Brody Henry.
And what's your date of birth?
9/16/92.
Okay, I'm just going to close the door for some privacy and do some hand hygiene. Is it okay if we film our session today?
Sure.
Perfect. Before we get started, I'm just going to ask you a few questions. Do you have any present illnesses today?
No.
No headache, any vertigo,
No.
any loss of equilibrium,
Nope.
changes in mental status
Mm-mm.
or levels of consciousness?
Nope. Good to go.
What about altered mobility?
Mm-mm.
Any tremors, weakness?
Nope.
What about incoordination?
No.
What about altered sensation?
Nope.
Any numbness, tingling?
None that I can think of.
Okay. Any difficulty eating?
Nope.
What about any difficulty swallowing?
Nope.
No. Any pain today?
Nope.
No. Any past medical history of hypertension?
No, not for myself, but my dad has high blood pressure.
How old is he?
He's 60.
Do you know the age that he was diagnosed?
He is 30.
30. But you know history of hypertension?
No.
Okay. Any history for you, hyperlipidemia or high cholesterol?
No.
What about any thyroid disorder?
Nope.
No. Any diabetes, cancer?
Nope. Healthy as an ox.
Any seizures?
Nope.
What about any head trauma?
Mm-mm.
Or spinal cord injury?
Nope.
Do you take any medications?
Nope.
Any allergies?
Nope.
For family history, living and dead relatives, any other history of hypertension besides your father?
No.
What about any neuro disorders, any seizures?
Nope, nothing I know of.
Okay. What about any diabetes?
Nope.
Cancer?
Melanoma cancer, my mom. Skin cancer.
She get it removed?
Yeah.
What age did she get diagnosed? Or did she get it removed?
No. We'll say 40.
40.
Somewhere in there.
How old is she now?
56.
Any history of genetic defects?
Nope.
Okay. For your social history, can you describe your home unit for me?
I live with my girlfriend.
Okay. What do you do for work?
I dig holes. Work in construction.
Do you have any issues functioning at work?
No.
Any stressors?
No.
Around any toxic chemicals?
No.
What do you do for fun? Or for like hobbies?
Travel, snowboard, golf.
Do you have any activity or exercise intolerance when performing those hobbies?
No.
Do you smoke?
Nope.
Any recreational drugs?
No, ma'am.
Do you drink?
Yep.
Beer, liquor, wine?
A little bit of everything.
Everything. When did you start drinking? What age?
21.
21. About how many alcoholic beverages do you have in a day or a week?
We'll do 7, 1 a day, 7 in a week.
Any history of any sexually transmitted disease?
No.
All right. I'm just gonna do a little quick review of systems. General, you have had no fever.
No.
Any chills?
Nope.
Sleeplessness?
Nope. Sleep like a rock.
Any fatigue or dizziness?
No.
Okay. Any rash on the skin?
Nope.
What about any visual disturbances or any visual difficulty?
Mm-mm.
No. Any tearing or redness in the eyes that you can
Nope.
notice? What about any difficulty breathing?
Nope.
Any nausea, vomiting?
Nope.
Any urinary incontinence, urinary frequency,
No, ma'am.
hesitation?
Nope.
What about any backaches or any weakness?
No. It gets sore every now and again from digging, but it's normal. Working hard.
Is it sore today?
No.
Okay. Any depression?
Nope.
Okay. Now we're just gonna start we're gonna start doing your cranial nerves.
Mm-hmm.
Cranial nerve number 1, olfactory. I'm gonna have you smell an item and with your eyes closed through each nostril and just tell me what you smell.
Sure.
Okay, I'm gonna go grab those items. I'm gonna have you close your eyes.
Okay.
Cover one of your nostrils for me and tell me what you smell.
Coffee.
Perfect. And then other nose, and then tell me what you smell.
Perfect.
Awesome. All right. Cranial nerve number 1, olfactory, is intact. Next, we're just gonna do the optic nerve, cranial nerve number 2. We're gonna start with the central vision. So I'm just gonna have you stand up against the wall right there. I'm going to use the Snellen chart. I'm gonna have you cover one of your eyes and read the bottom lettering for me if you can.
LTFPH.
And cover your other eye. And same thing.
LTFPH.
Perfect. All right, you can sit back down. And then we're gonna just do your peripheral vision now. I'm gonna have you cover one of your eyes again, and then I'm gonna hold up one of my 5 fingers, and you'll tell me which number you see, okay?
1, 2, 1, 4.
Perfect. Other eye.
1, 2, 4.
Perfect. Central and peripheral vision is intact, and then I'm just gonna look at your eyes with my pen light. Look at your pupillary reflex. Know your pupil size. Just look at my nose for me. Then I'm gonna do the same thing, but I'm gonna look in the other eye. Perfect. Pupils are equal, round, and reactive to light, both direct and consensual. Next, we're gonna test for accommodation. So I just want you to start my finger.
Mm-hmm.
And perfect. Central movement towards the patient's nose. We're gonna move on to cranial nerve number 3, oculomotor 4 and 6, truncular and abducens. Doing the 6 cardinal fields of gaze. So I'm just gonna have you look at my finger again, and we're gonna go in an H motion, starting right here. Perfect. Cranial nerve 3, oculomotor 4, truncular and 6 abducens are intact. Next, we're going to do cranial nerve number 5, trigeminal. Can I just have you clench your jaw for me? Thank you. Next, for cranial nerve number 5, we're going to test the sensory function whenever we do the rest of the sensory assessments. We're going to move on to cranial nerve number 7, facial. Can I just have you raise your eyebrows for me? Close your eyes really tight, open them really big, and smile for me, and then try and frown. Good. Cranial nerve number 7 is intact. And then for cranial nerve number 8, we're going to assess hearing acuity. I'm just going to have you hold down on one of your tracheases, and I'm going to whisper a word behind you and just tell me what you hear, okay?
Sure. Orange.
And then other ear.
Dog.
Perfect. Cranial nerve number 8, vestibulo-ocular is intact. And then for cranial nerves 9 and 10, can I just have you open your mouth and say ah for me? Perfect. And then I could test also with a tongue blade, the gag reflex, in addition with having the patient say ah. Next, cranial nerve number 11, spinal accessory. Can I just have you shrug your shoulders for me? And then shrug them again. Perfect. Next, I'm just going to have you push your head against my hand, same side, and then try and push back, and then push forward. Perfect. Cranial nerve number 11 is intact. Next, we're going to do cranial nerve number 12. Can I just have you repeat this phrase for me? Light, tight, dynamite.
Light, tight, dynamite.
And then can I have you stick out your tongue for me? And then can you move it left to right for me? Perfect. Okay. Next, we're going to go on to motor function, inspection and palpation. So I'm just going to look at the patient's upper and lower extremities, noting the muscles, shoulder muscles, and then go down to the lower extremities. Noting any involuntary movement. And then I'll have you close your eyes, touch your index finger with on your nose. And then do the same thing on the other hand. Perfect. And then we're gonna do what's called the Babinski reflex. And then lifting the patient's foot up. I'm going to take this and drag it on the sole of the foot, ending at the ball, looking for any spreading of the patient's toes. Next, we're going to test for cerebral function. So I'm just going to have you stand up and kind of walk across the camera for me.
Walk?
Just walk normal. And then on your way back, if you could walk on your tippy toes. Okay, and then on your way back, walk on your heels. Perfect. And then again on your way back, kind of do heel to toe. Perfect. Okay, and then for the camera, can you just stand with your feet together? I'll kind of mirror you of what you're supposed to do. Just stand normal, your eyes open, and then close your eyes for me. Looking for any swaying, you can open your eyes again. And then I'm just going to have you extend your arms for me with your palms up. And then assessing for any pronator drift. Okay, next we're gonna do heel to shin. Take your heel, put it on your knee, go down your shin, and then go back up. And then do the same thing on the other side. Knee, down your shin, come back up. Perfect. Okay. Next, we're just gonna do your light touch with this little cotton pad here. Doing your upper and lower extremities bilaterally, checking your lateral arms here, the inside of your forearms, the thumbs, the middle fingers, and the pinky. And then for the lower extremities, we'll do the anterior thighs, medial and lateral calves, and then the lateral feet. With the patient's eyes closed, just tell me left or right, which side. I'm gonna touch you with the cotton pad, okay? Ready?
Left. Right. Right. Left. Right. Left. Left. Right. Left. Left. Right.
Perfect. And then we're gonna go down next to your lower extremities. Have your eyes closed.
Right. Left. Right. Left. Left. Right. Left. Right.
Perfect. Next, we're gonna test your superficial pain, testing sharp versus dull pain. This is gonna be the sharp, and then this is what the dull is gonna feel like. Starting at the upper extremities first, have you close your eyes? Okay, sharp versus dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Perfect. And then for your lower extremities, same thing. Close your eyes.
Sharp. Sharp. Dull. Dull. Sharp.
Okay, perfect. And then for your proprioceptive sensation, I'm just gonna have you spread your fingers out for me, and then I'm gonna I'll test your other hand. I'm just gonna move your index finger up or down, and then close your eyes for me. Just tell me if I leave it up or down.
Up.
Okay. Keep your eyes closed.
Up. Down. Up. Down. Down.
And then other hand.
Down. Up. Down. Up. Down.
Okay. And then I'm gonna move down to the lower extremities. Do the same thing as I did on the hands. Close your eyes. Perfect. Up or down?
Down. Up. Down. Down. Up.
And then other foot.
Down. Up. Up. Down. Up.
Perfect. We checked both upper and lower extremities bilaterally. Next we would do the vibratory sensation on upper and lower extremities using a tuning fork, but I do not have one today. So we're just gonna do the familiar objects. I'm gonna have you just kind of take a feel for the paper clip, feel the object, and then same thing with the coin, and then pen. So I'm gonna use these three objects for you to identify with your hand, and just tell me which one you think I hand you. Okay, I'm gonna try on your left and right side, both bilaterally. Okay, close your eyes and then tell me what object you feel.
A pen.
Okay, perfect. And then keep your eyes closed. I'm gonna give you another object.
Paper clip.
Perfect. Perfect. And then to test for graphesthesia, I'm just going to either draw a letter or a number in the palm of your hand, and can you just tell me what letter or number you feel me draw?
Sure.
Okay. Close your eyes for me.
1.
Perfect. And then
H.
perfect. Now, for the last thing, we're just gonna test for your reflexes using a reflex hammer. We're gonna start with your biceps first. Put my hand over the bicep tendon, palpate for it, and I'm gonna hit over my fingers. You should feel the bicep tendon. Right. And then for the brachioradialis, then next, we're gonna move on to the triceps. Have you lift your arm for me and just kind of relax for me here. Perfect. And then same this side. Relax. Okay. Next, we're going to move down to the lower extremities, move on to the patellar. You can see his knee. Good. And then other knee. Good. Moving down to the Achilles. And that concludes our focus neuro assessment. Do you have any questions or concerns for me today?
Nope.
All right, the provider will be in to see you shortly.